Hey, it's Clay, CPAPmyway, CPAPmyway.com. Today we wanted to bring you some really cool information from some of the big sleep organizations, specifically the American Academy of Sleep Medicine and the European Respiratory Society. Both of them have put out statements regarding what they would recommend physicians do with patients that are dealing with this recall issue. So with that being said, this is not CPAPmyway or Clay's recommendations to you. This is information that is being shared from these organizations to doctors about you. So it's information that you should know, read over, take into account, obviously, personally, and then share with your doctor and see if you can make a good decision as to what you ought to do next in regards to this recall from Philips and your particular sleep issues. Additionally, we got this really cool flowchart that we were able to secure. It's been passed around by some of the local sleep physicians, so it may be something you could share with your doctor. It was, we found it to be really clear as far as good recommendations go as to, like if-then scenarios. So we'll share that with you at the end as well. First up, American Academy of Sleep Medicine. A majority of this is a little repetitious as to what Philips has said already. So they basically took Philips' advice and kind of spun it a little bit, in my opinion. Again, I'm going to have the links to all this in the description, so feel free to read it through in its entirety yourself. I'm going to summarize here and throw up some screenshots. Also, feel free to pause it and read those in detail if you'd like. But first and foremost, they're saying if you're using a ventilator, a Trilogy, to keep using it if you can't get another one with the use of bacteria filters to make sure that the foam doesn't come through. And then on the CPAP and BiPAP, they're pointing out first off that it's going to take some time for Philips to get this right. Obviously, you're looking at millions of devices. They're also recommending that doctors look at the full patient picture, right? So does this person have comorbidities like heart issues? How severe is their sleep apnea? Will it impact their life significantly or cause risks of accidents or injuries? Then secondarily, they're saying, can you get an alternative therapy, like a different positioning, like maybe a wedge cushion or a mandibular device, like an oral appliance, maybe even surgery. And then third, they're saying that, a patient should consider losing weight, avoid the booze, and sedatives before bedtime that would make sleep apnea worse, obviously. And then as far as things they're advising doctors to keep in mind if they're advising you to continue using the CPAP or BiPAP is obviously what we had discussed earlier. If you have heart problems, would you potentially have drowsy driving? Are you a professional driver? Could you have an accident that would hurt you if you were obviously sleepy during the daytime? And then also for the doctors to keep in mind that the complaint rate was low in 2020, 0.03% of complaints on this particular issue to Philips. And then obviously a big thing here that they're pointing out, Philips has reported no patient impact related to chemical emissions. And then obviously to make sure that the patient doesn't do anything to exacerbate the foam degradation, like continue using of ozone on the CPAP, there's integrated ozone cleaners. As well as high heat and high humidity areas, which seem to cause more issues for that foam. And if they're going to make a recommendation for you to keep using it, they want you to basically, want the doctor to basically attest that they've gone over all this with you and make sure they cross their T's and dot their I's, that they've given you advice to continue using it in the best of recommendations. The next one is the European Respiratory Society. I found this one to be a lot more direct and insightful, quite frankly. So they say right up front, just like, the AASM, you got to weigh out the risks. But specifically, they're saying, balance the real risks of what could potentially happen from using your Philips device versus the real risks of what could happen if you're not treating your sleep apnea. And those are important distinctions. They point out that there has been no evidence of acute life-threatening incidents with patients using these devices, that a patient should not stop or change their therapy until they've spoken with their doctor. Their advice to doctors in regards to you using one of these devices is that you should not stop using the device until an alternative is available if you have significant issues, comorbidities, severe sleep apnea that might result in some issues. If you have moderate symptoms, they're saying, maybe you should consider an alternative, such as an oral appliance or, sleep position modifier. And then for people with mild symptoms, they're saying, maybe you could go without it until you can either get a new device or yours can be repaired. All that being said, they're saying very clearly here that if you're going to continue using the device, you should use an inline bacteria filter. Now, we went over a little bit of that in our last video, and I'll throw a link here as well to that so you can look that back up. But it looks like from what they're saying the particulate sizes are, that bacteria filter should catch a vast majority of any kind of foam particles that pass through the device. One real cool thing that I kind of talked about earlier was this Flowchart. On the Flowchart, again, this is recommendations to doctors. I got this from a doctor's clinic locally, so I thought I would share it with you so you could share it with your doctor in case they haven't seen it. It breaks down this information that you've gotten from some of these places as well as others, and puts it into a really nice if-then scenario. So first off, they're saying register your device. Number one, a patient should register the device so that they're eligible for the recall or replacement or repair. And then advise patients to stop using unapproved cleaning methods on the actual CPAP device, and then to avoid high heat and high humidity. First thing they ask after that is, does your patient use one of these machines? Basically a ventilator, oxygen, or a BiPAP with backup rate. If yes, patients should continue to use the device until it's repaired or replaced, and then make an appointment to see their doctor. And then it specifically says to use an inline bacterial filter on any ventilatory device. If the answer to that question was no, you go on down to these questions. Does your patient have any of these diagnoses? COPD, hypoventilation, pulmonary hypertension, neuromuscular disease related to respiratory problems, past or present cardiac arrhythmia, heart failure? If yes, back over to continued use with bacteria filter on ventilatory devices and make an appointment with their doctor to discuss options. If the answer was no to those previous questions as well, ask these questions. Is there any DOT license requirement for this person to treat their obstructive sleep apnea? Is there any occupational operational safety requirements? Does this person have extreme sleepiness or drowsy driving prior to using the CPAP or BiPAP treatment? Has there ever been a recent hospitalization for breathing problems? Would discontinuation of CPAP therapy lead to substantial deterioration of functional status or quality of life? If yes, back up to continue using the device until it's repaired or replaced with a bacteria filter, and make an appointment to discuss treatment options. If no, obviously jump straight to the treatment options here on that one. And the treatment options they're saying that a doctor should discuss with you are get another device that's not impacted by the recall. Discuss alternative treatments. Discuss some of those already. Discuss behavioral strategies, weight loss, exercise, avoidance of alcohol and sedatives before bedtime. And then, of course, they're telling the doctor to document all of this in your chart to make sure that they cover themselves as well. But we found this to be, pretty good information, at least something that you could discuss with your doctor potentially in an effort to find out what your best case scenario is. Obviously, we hope that everybody's already registered their device, that they're on the list, and we're really hopeful that Philips gets that ball rolling pretty quick on those repairs and replacements. So, as always, if you like the info, hit us with a thumbs up. Feel free to share it. Comment with any questions or insight that we could use on this video. We'll throw everything we can in the description as far as references. And as always, thanks for watching.